My Lords, I'm grateful to those who've joined this debate, the Library for preparing its excellent briefing, and the University of Manchester and the British Society for Antimicrobial Chemotherapy, among others, who've prepared additional material on a subject that may, at first, appear niche and specialist. Yet I hope by the end of this debate will be much more familiar to this committee and far beyond, its status lifted up in DEFRA and the Department of Health's agenda. I must also thank my BSAC intern, Lorna Flintham, who's played a major part in my preparations for today. The severity and widespread impact of fungal disease and fungicide use are often greatly overlooked. Annually, over 150 million severe cases of human fungal infections occur worldwide, resulting in about 1.7 million deaths a year. Many of those deaths are because the drugs that once worked to cure now work no longer, because the fungi are resistant, and that's not solely or even primarily because of medical use of drugs. First of all, a quick distinction. Antifungals are human medicines used to treat fungal infections. Fungicides are pesticides used to treat and prevent fungal plant infections, particularly in food crops. 4,000 tonnes of fungicide are sprayed on arable crops annually, accounting for 38% of pesticide use. And they're not used without reason. The Irish potato famine, African wheat blight, the way our world coffee industry sits now in South America and not where it originated in South Asia, these are all the result of fungi defeating human efforts. The problem is what these fungicides are doing to our environment, our food security and our biosecurity. First, their direct killing action. To date, no policy document has shown an appreciation for the state of the UK soil microbiosphere and how it's being affected by biocides like fungicides. We benefit hugely from mycorrhizal fungi and indeed from many other fungi who break down materials that would otherwise literally cover our planet. But they're being eradicated by indiscriminate fungicide use in industrial agriculture in what is being termed a large microbial extinction event. Not only is this destroying environmental biodiversity, but soils depleted of these fungi have lower crop yields. 80% of our food is dependent on plants. Lower crop yields are only going to push food security and supermarket prices one way. Then there's cross-resistance. Most fungi exposed to fungicides in the crop field will die, but some will survive and become inherently resistant to the fungicide due to natural selection. It will also, in the field, stop working. The key issue is that the fungicides they are resistant to are extremely similar chemically to the antifungals we rely on to treat patients in healthcare. By developing resistance to fungicides, these fungi also develop cross-resistance to clinical antifungals. More and more patients are coming forward with resistant fungal infections that healthcare providers simply cannot treat. Fungal diseases affect over 1 billion people every year. For those billion people, antifungals are indispensable tools in fighting infection. Development of treatments for fungal diseases in humans is intrinsically more challenging than agricultural fungicides due to the shared characteristics of human and fungal cells. That is, it's very challenging to eradicate a fungal cell without also damaging the host. Therefore, the utmost care must be taken to produce and protect effective antifungal drugs. Now, there's one new emerging antifungal drug, oloroform, that has been effectively trialled in aspergillosis treatment. This is a highly debilitating fungal lung infection with a 30 to 50% death rate, even when the strain is not resistant to medication, which 20% of cases are. Oloroform could make a real difference to the patient population, but there's a big problem. Its efficacy is threatened by epfluorofenoquin, a newly developed agricultural fungicide. These two drugs both use the same mechanism of action to kill fungi, a big problem considering cross-resistance and the spread of resistance from our fields to our hospitals. As a government priority, the approval of epfluorofenoquin for use in agriculture and other commercial sectors should be paused pending further investigation to the cross-resistance risk. I hope the Noble Lord the Minister, to whom I've given prior notice of all the questions in this speech, will be able to directly respond on that issue. We should not be allowing the approval of a pesticide that could undermine decades of antifungal drug development and risk the well-being, the life of thousands of patients who could benefit from it. There is an opportunity here to truly benefit physically vulnerable people, who most of the effective patients are, who are absolutely reliant on this new breakthrough medication, which is indeed a spin-out from University of Manchester research. Further, the government needs to assess the feasibility of ring-fencing certain mechanisms of action for human antifungals. Ring-fencing could prevent the fungi in our environment from being exposed to similar chemicals that we use to treat fungal disease in healthcare, ultimately safeguarding effective antifungals for the future. In addition, to promote the safe deployment of novel fungicides, regulators should introduce new criteria when approving antifungal compounds for commercial use. I would ask the Noble Lord the Minister if the government is looking at that. Our infrastructure could greatly benefit from developing a risk management framework to evaluate the likelihood of cross-resistance emerging between new agricultural antifungals and existing clinical agents before they are approved for use. This is a genie that, once it's out of the bottle, cannot be put back in. In doing so, we can stop the inevitable inefficacy of antifungals going forward and allow our UK antifungal innovation to remain competitive. Unsurprisingly, it has to be noted that the climate emergency will only increase the pressure to act. The UK Food Security Report of 2021 only mentions fungal pathogens 3 times in 322 pages. However, it does note that warmer temperatures can also encourage fungal diseases such as potato blight, backing up what the science has told us in multiple directions, that the effect of the climate emergency on plant diseases, of which 80% are fungi-based, will lower crop yields. In humans, fungi such as the valley fever pathogen are known to thrive in warmer soils. More frequent severe storms, floods and hurricanes are also increasingly dispersing harmful fungi across hundreds of miles to human hosts, potentially causing infection outbreaks through what were previously rare diseases. Here in Parliament, we need to very seriously consider how fungicide use will fit into the growing pressure from fungal diseases in a warming world. Coming to a broader issues, increasing our fungicide use in agriculture is not the answer. In fact, we clearly have to massively decrease it. Innovation should not automatically mean new synthetic chemicals. We need to make further research funds available to replenish the antifungal and fungicide pest line, yes, but much more, we need to explore innovative agricultural practices that reduce our reliance on fungicides. The Noble Lord the Minister has frequently expressed agreement with me about the need for agroecological practices. To put it another way, as does the Exeter researcher Jamie Lorimer, we need to use life to manage life, because that's using mechanisms that have been around for hundreds of millions of years. Our approach to agriculture is outdated, based on a time when we were not aware of the environmental and human risks of pesticide use. In this vein, I would strongly urge His Majesty's Government to share their plans and ask the Minister when we will see the new updated UK National Action Plan for Sustainable Use of Pesticides. Striking the balance between prioritising our food security and with safeguarding our clinical treatments is, I will acknowledge to the Government, an impossible challenge, but it's also an essential one that we have to meet as best we possibly can. Managing fungal crop disease has always been essential to our ability to feed the population, but we can't afford a haphazard piecemeal approach that will hurt our public health and our NHS. We need integrated One Health considerations of the impact of the climate emergency and responsible fungicide legislation. Now, mitigating these risks will require the Government to work collaboratively with cross-sector stakeholders, clinicians, industry representatives from agritech and pharma, third sector organisations in both places, and farmers themselves. And globally, of course, as we're being reminded with reports of a new disease outbreak in China, no one is safe until everyone is safe. Can the Minister tell me if the government is working with the quadripartite, the organisation that brings together the WHO, the FAO, the UNEP and the WOAH, to look at the specific issues of antifungal and fungicides that I've outlined, and also ensuring that they are working to seek mechanisms to reserve particular actions of chemicals for human drug use? Urgently, we need to delay the approval of vitfluphenacin in the UK pending further investigation and leverage the international mechanisms to address the approval of this chemical worldwide. Ultimately, no one is safe until everyone is safe. I look forward to the debate today, and I hope to continuing urgent consideration of the issues raised. I beg to move.